Have you ever wondered what herb to give to a patient that's struggling with fatigue or burnout or some level of just lack of adaptability to stress? Well, today I'm going to talk to you about the latest clinical research having to do with adrenal health, cortisol, stress management, etc. We're going to talk about what's new, what's trending, what's surprising, and what you can start using with your patients right now. So grab your notebook, grab your highlighters, and your nerdy brain. Let's dig into the data. Welcome to the Clinical Entrepreneur Podcast. I'm Rhonda, your no-fluff, tell it like it is business bestie for wellness practitioners just like you who want to build a practice you love and make a bigger impact and a little money while you're at it. So if you're ready to ditch the overwhelm, attract your dream, ideal patients, and finally run your practice with complete confidence, you're in the right place. Each week, we're tackling things from programs to patient retention to marketing strategies that actually work, sprinkled, of course, with a little sass, a lot of heart, and the step-by-step strategies that will help you get there. So grab your cup of coffee, your notebook, or whatever keeps you going, and let's build a practice you love and a life you love together. Today, I wanted to talk about clinical things because I love that just as much as I love business. And I thought a good topic would be about adrenal stress handling, what's kind of new and updated in the research, et cetera. And there were some pretty cool things. So some of them you might know, but there was a few interesting ones that I thought I would just share with you. So of course, when it comes to the herbs, I had to expand them a bit and put in a little more juice, put a little squeeze in it so I could give you a little bit more detail. But let's dive in. I would say that, patients come in, maybe not as much now, but boy, back, in early 2000s anyway, and even in the trends, patients were always coming, I have adrenal fatigue. I just know I have adrenal fatigue. And I've never been a proponent of the term. I don't believe there is such a thing. I think we can have adrenal insufficiency, or probably even better stated, maybe adrenal dysregulation, but I don't think adrenal fatigue is the right word. Fatigue is how they feel. The adrenal glands may or may not be involved, right? Could be blood sugar, the reason that they're tired. It could be an infection. It could be all kinds of things. So I think we have to be a little bit more specific about how we talk about this. And that being said, it's very misunderstood, in my opinion. It's a commonly misunderstood aspect of our health, but it's an important one because so many people come in saying, whether they say I'm tired or I'm just stressed out or I can't handle life, or maybe light, sound, noise disorder bothers me, or I wake up in the middle of the night. There's all kinds of reasons that they might have altered cortisol or altered circadian rhythm. Could even be, irritability, adrenal issues, or cortisol issues, weight gain, poor sleep, et cetera. So let's just dive into what the current research is kind of say. So I broke this into several parts. So the first part, let's talk about cortisol and the brain. There were a couple of studies I thought were really relevant. One is about having a dysregulated cortisol pattern and chronically stressed patients. Makes complete sense, right? What they found was that a flattened cortisol slope is more predictive of burnout than total cortisol output. And I found this really interesting because, if you've been hanging around with me in Clinical Academy or in any of the seminars I've taught for years, I've been teaching seminars for, going on 15 years. And whenever I would share a cortisol test, I use Diagnostics, you all know this, but I love their tests. They have what I call the lazy boy chair. And it's, cortisol should be higher in the morning, drops down around noon, bumps up a bit in the afternoon at where your knees would be, right? Head, butt, knees, feet. Kind of think about that, a lazy boy chair. The top is in the morning when you wake up. Where your butt goes, that's noon. Then your knees are kind of up a little bit. That's mid-afternoon. And then it drops down at night, as it should, so that we can go to bed. So what the study found was that, let me back up. One of the things I look at is the total cortisol output. In other words, how much cortisol is the body putting out? And I've always kind of thought, it could be dysregulated. The lazy boy chair curve could be dysregulated, but that doesn't necessarily mean that the adrenal glands are failing to produce cortisol. The output might just be, or the order, right? High, then dropping at noon, back up a little bit at 4, and then way dropping at night to go to sleep. That might be off a little bit. But the study said that more predictive of burnout, like full-on burnout, is a flattened cortisol curve. And what that basically means is that the HP axis is now having difficulty connecting to and getting a response from the adrenal glands, i.e. the glucocorticoid response, cortisol. It's not getting a response from cortisol. So either A, the pituitary is signaling and the adrenals aren't responding, or B, the HP is not responding and the cortisol is ready to go. Either way, we have a problem within the axis, and we want to restore the normal circadian rhythm. In that, a recommendation is, like, of course, first morning sunlight, within that first hour of the sun peeking up over the horizon. And if now, the time of this recording, we're heading into summer. And so, I live in the Pacific Northwest at this moment in time, and sun comes up early. So I have to get up early to get that first morning light, but that makes a big difference. It can reset that cortisol first thing in the morning. We want to get that cortisol back on that lazy boy chair pattern so that the patient feels better. Also, meal timing is a big deal, and breath work to just reduce that stress. We're going to talk in a little bit about how to layer in some adaptogens. So put a pin in that thought for a minute. The second study was along the same line, HPA axis and cognitive decline. And this was a meta-analysis that was done in 2023, but they found that when the HP axis is dysregulated, that the hippocampus volume, overall volume, and working memory is decreased. And the hippocampus is where we find our emotions are stored. So emotional triggers, our ability to respond to those emotions, it's going to be altered. So when we address stress with our patients using adaptogens or direct herbs that are adrenal restoring herbs like Rhodiola or Licorice, we're actually helping to protect the brain as well. So again, we want to think about herbs to be able to reset that HP axis, but we also can think about, like on the standard process side, they've got hypothalamics or pituitrophin, and Doctors Research has a couple of products. There's other companies that have them. Gaia has one, daytime HPA. It's a really popular product. For that reason, because is it the hypothalamus, the pituitary, the adrenal glands? If we can reset the stress, then we're going to protect the hippocampus. And also the hippocampus is where we've got working memory. So people who are forgetful, I have to say, I kind of feel like I'm in that camp, because when my stress gets high, I'll have a memory come in and then it's just gone. But it's because I have a lot of, I'm just got a lot of plates and I'm juggling a lot of balls. And when I can calm that nervous system response down, it's like my brain has room to remember. So think about that with patients who complain about maybe shorter term memory, or, they're afraid they're getting Alzheimer's or something like that. Just try and settle that stress response, get that hippocampus and HPA axis working, and they're going to start to feel better. All right, now part 2. Now we're going to get into what I think are the darlings of adrenal support, which are my favorite herbs, and those are adaptogens. I'll never forget this one day when many of you may not know, but I used to work for Adaptogens, and I was in their clinical support team. I did a lot of clinical work with them, and I was one of the people that would answer the phone when someone would call in for clinical support. Like you can do now, you can set up an appointment and call in. They'll go over your test results with you. So I did that for, a year or two. I just helped them out. They needed some help. And I loved it. It was great because I got to talk to a lot of you and I got to look at your tests. So I have literally seen thousands and thousands of these diagnostics tests. That's just why I love them. I know how the tests work so well. And so I remember it was back when adaptogens kind of started to gain momentum. And one of the doctors at the lab, I'll never forget this. I said, I really think that these adaptogenic herbs are going to have a big impact on how we address dysregulations in the adrenal stress index, the ASI. That's one of the diagnostics panels. And we'll talk more about that in a minute. But I said, I really think these adaptogens are going to make a big difference. And I remember, I'll never forget, he looked right at me. I was standing in the doorway of my office and he was out in the hallway and he looked at me and he said, I think this whole adaptogen thing is just a joke. It's not even real. I don't even know how a plant can have that kind of an impact. There's no way. And he got kind of indignant with me and he turned around and he walked away. And it made me doubt myself. I mean, my gosh, I have quite a long list of training in herbal medicine. And I thought, well, maybe I'm wrong. Isn't that funny? Someone says one thing and then you start to doubt what you know, but I've been doing this forever. So I'll never forget that. He just really didn't have any value in it. And it wasn't until a couple of years later, he came back to me and he goes, I think that there's really something to it. I'm like, yeah, duh, of course there is. So let's talk about two of my very favorite herbs. You know what my first one's going to be. And that is, they did a study. It was a 2023 one, randomized control trial. And it was on Rhodiola versus Ashwagandha, using those two in stress-related fatigue. So, of course, I have to go in and do a whole bunch more for you and give you a bunch more about these two herbs. But first, let's talk about ashwagandha. Ashwagandha is what I think is a true adaptogen. And that means it really helps the body maintain homeostasis and recover from any kind of physiological impacts of stress. And so it really is a true adaptogen. I like to say it just kind of puts your butt in the chair. You don't float around in la la land thinking, oh my gosh, chasing this, chasing that, chasing this, stressed out, worried about. It kind of just brings you back down to earth and just puts your butt right in the chair. You're like, okay, I got this. That's ashwagandha. I love it because it helps to modulate the HPA axis. So it reduces cortisol levels. As it settles that HPA axis, it helps to reduce cortisol levels, and then that puts that cortisol back in that good lazy boy chair type pattern. So it downregulates cortisol. It improves in our just overall resilience, aka an adaptogen, right? That's what it does. And our perception of stress. So it might be something that I would say, it helps to take the trigger out of someone who pushes your buttons. You know how you have your spouse will say something or do something and you're just like 0 to pissed fast. I'm ratting on myself, maybe a little, or I just maybe know someone. Anyway, you just are like, the adaptogens, especially ashwagandha, takes that bite out of that response. And it just lets you go, well, all right, here we go. It just takes the charge out of it. Helps with sleep, helps with insomnia, anxiety, fatigue, that kind of thing. So love me some ashwagandha. It's also been shown to be good in the study for stage 1 to 3 adrenal dysregulation. And that's where cortisol either can start to elevate or it can start to decline, right? That stage 3 is where it's really, really declining. So ashwagandha is kind of a grounding herb. I guess that's a good way to say it. Butt in the chair, it like grounds you. It's very nice, very calming, brings in that parasympathetic. It also is good for the nervous system, musculoskeletal system, male reproductive health, including like testosterone production, sperm quality, and also libido. Good for men, it does that work. It's not so much libido for women. Sleep, thyroid, great, because ashwagandha is very gentle at encouraging T4 to T3 conversion. I don't ever worry about ashwagandha over converting. Like I've had patients or doctors ask me, well, what do you think about it? We shouldn't give it to someone who is, hypothyroid because what if it makes whatever worse? I'm like, no, that's exactly what you want. It's just very mild, so it's not a big deal. So anyway, ashwagandha is like really, really one of my faves. And then we have to talk about rhodiola, right? Rhodiola is really helpful for people who are, I think that one has more to do with your like energy. It acts very, very much on like endurance and performance and that kind of thing. The rhodiola is just different. It helps to modulate in a little bit of a different way. It helps more in that HPA axis. So it's good for like physical exhaustion and mental burnout. So if you're burning a lot of brain cells because you're thinking all the time, or you're doing a lot of critical work or reading, or even someone who's emotionally depleted, I've used rhodiola really successfully for that as well. So if there's poor concentration, fatigue, just kind of overall stress, rhodiola kind of puts gas back in the tank. And it modulates that sympathetic response and the HPA axis. So I could go on and on about these herbs. I should probably cut this short because we have a lot to cover today. So the key mechanisms are just regulation of cortisol release, and then reducing stress. But it also, rhodiola helps with ATP production in the mitochondria. That's where we get the energy bump with rhodiola. So cellular energy. And I love this too, because rhodiola is really good for serotonin, dopamine, and norepinephrine balance. So under stress, when we start to lose those neurotransmitters, rhodiola helps to bring them back up. It's like the happy herb. So think about rhodiola when you want to improve somebody's mood, when you want to help them with stress reduction or stress handling, give them a little bit of energy, Rhodiola is excellent. And so you can see that Ashwagandha and Rhodiola, they really have two very different roles, yet at the end of the day, they're helping the organism, i.e. you, me, the patient, they're helping the organism or the host really upregulate its responses to stress. And Rhodiola is pretty fast acting. Well, I think both of them are. They're both pretty fast acting. So you can get a nice lift, like give someone that in the office and they'll feel right better. So don't throw every adaptogen at the wall. In other words, don't throw them all at the patient, but match it to the clinical presentation as much as you can. All right. The next study had to do with licorice and cortisol. So let's talk about this. This is a question I get all the time when I'm talking about licorice, especially using like licorice and white peony together for PCOS. People get their panties all in a pinch about, well, you can't lose licorice because of hypertension. Okay, let's just talk about it, shall we? Hopefully, this is going to put this conversation to bed for all y'all. Here we go. So there's licorice, full spectrum licorice that has the glycyrrhizin in it. And then there's deglycerized or deglycerized. I cannot say it the other way. Forget it. Deglycerized licorice. So the deglycerized licorice has the glycyrrhizin removed, okay, or mostly removed. Now let's talk about why we want the glycyrrhizin, why we want the full spectrum licorice, and then I'm going to talk to you about what the benefit is of the deglycerized, because there is a benefit, but they have two very different uses. So with full spectrum licorice that has the glycyrrhizin, what it does is it inhibits a certain enzyme. It's the 11-beta HSD2 enzyme. And what that does is that enzyme converts cortisol to cortisone. But what that does is licorice, the glycyrrhizin, it inhibits that. So it keeps cortisol a little longer for that patient who's run down, worn down, stressed out, adrenal glands are gasping for air. And we know that this glycyrrhizin in there, it can, in some people, maybe deplete a little potassium and affect the mineral corticoid receptors. That's what it does. It's okay. So if you give it, well, first of all, you have to give a very high dose to even get close to a therapeutic level or a level that's going to impact hypertension. However, in 20 plus years of clinical experience, I have only had one patient that got mildly sensitive. And I can't tell you, I've used licorice with thousands of people. And I've only had one person, and it was very mild. In fact, I honestly think it was probably psychological. I don't think it really happened. I think she read about it and then believed it and then, oh no, my blood pressure's up. I said, no problem. Just stop the licorice. And within 24 hours, it was back to normal. And I said, okay, well, if you're worried, then we'll just reduce the dose, or you can just take a half of a potassium tablet. Just go buy a potassium over the counter. It's fine. Because that's what it does. Too much licorice, the glycyrrhizin, it can interfere with the mineral corticoid receptors, but it's not a big deal. It's nothing to be worried about at all. But it is exceptional for patients who have low cortisol. Let's say the adrenal glands are not producing much cortisol. If we give licorice, what we're doing is we're extending the life of that cortisol, not letting it break down as quickly into cortisone. And so the patient's going to feel better on licorice. When we start getting more cortisol in, they're going to start to heal better. They're going to start to sleep better. They'll start to feel better. So full spectrum licorice is not a bad thing. It's really great for patients who are just burned out. They're just burned out. They've got low cortisol, stage 3, Cellier's scale, the burnout. There was another study that showed that when they combined glycerized full spectrum licorice with grapefruit juice, they had a significant increase in serum cortisol and the cortisol to cortisone ratio in patients with Addison's, which is really fascinating. So there you go. That's the full spectrum licorice. So then you must be thinking, well, what is the non-full spectrum or the deglycerized licorice good for? Well, clearly, it's not going to be very good for cortisol because it's the glycyrrhizin that does the job, right? So in deglycerized licorice, what it does is it supports mucosal health. Isn't that just amazing that these herbs will do this? So when you take out the glycyrrhizin Now you have licorice that rebuilds and repairs mucus linings, and it is flippin' amazing for that. So if you have someone who has damaged mucosal barrier, you'll see this in patients who, let's say they don't tolerate spicy food. Why do you think, I'm telling you, this podcast is going to go way too long. I'm just saying it right now. Just sorry, not sorry, but I can't help myself. Listen, if you have a patient who is complaining about they can't eat spicy food and everything bothers them and they have heartburn and they've got some burning in the stomach, you already know automatically mucus lining screwed up, because that mucus lining should be thick enough in the stomach that the nerves are never exposed. They have no sensation to heat or anything like that. A spicy should never have that feeling. Stomach should not have sensation because the mucus barrier is intact. Well, why does the mucus barrier break down? Because of stress. Hello? Do you see the same herb that manages the stress also heals the mucosal lining? Now, let's just take this one step further. If we were to leave the glycyrrhizin in and use the full spectrum, does that mean that it doesn't work on mucosal health? No, it does not. It means you get both. So I'm just saying, in my opinion, better to eat the whole orange than just think that ascorbic acid is the answer. How about we just use the full thing, the full spectrum licorice, and let the body choose what it wants to do. And if you're bothered about the blood pressure, well, just tell them to keep an eye on it, or don't tell them at all and just check on them once a week. You can manage it the way that you feel comfortable, but unless you are giving extremely high doses of licorice, which you wouldn't be, you follow the dosing instructions on whatever product you do, I can promise you it is within the range. I would recommend the licorice that comes from Standard Process or MediHerb. I love that. And then anything from Gaia, and you're going to be completely fine. Really, follow the instructions, you're going to be fine. So there's my soapbox about deglycerized licorice. But back to the study, I don't know, that's what we started with, right? They found that licorice root, extends the life of cortisol. We already knew this. So there you go. My belief is use the whole thing, but if you have to, if you're just a little too nervous, just get the deglycerized, but you're not going to be helping with cortisol at all, only mucus barrier. Okay, I'm off my rant, but I'll find another one probably. Okay, here we go. Next one was a study on holy basil and mood. Here's what's fascinating about this one is that holy basil, they found that it actually rivals, Tulsi is another word for that herb. That's a botanical name, Tulsi. But it rivals, they said, some of the SSRIs. Isn't that cool? So it influences dopamine, serotonin, and norepinephrine. Well, what was the other herb that has that same thing? Do you remember? It was rhodiola. So if we really wanted to boost somebody's mood, could we give them rhodiola and Tulsi or holy basil together? I don't know, maybe, like if it's right for the patient. So holy basil has a very direct impact on the neurotransmitter activity. For rhodiola, it's kind of secondary. But this is holy basil, like it's straight up right on those neurotransmitters. I'm not a fan of neurotransmitter testing, and the reason is because 80% of them are made in the gut. So that tells me that holy basil has to have some impact on the production of those neurotransmitters in the gut. But they found that it actually had a tremendous impact on mood. So think about holy basil with a patient who is feeling the blue funk, but they don't want to go on an SSRI. Then the holy basil is going to be your slam dunk herb. You're going to want to use that. It also, they found in the study that it helped to daily supplementation with holy basil reduced the perception of stress, anxiety, and depression. So they believe that it also has a role in cortisol, improves cortisol, which I would agree with, and HPA re-regulation or resetting that HPA axis. So, they're less emotionally reactive, they're happier, they're, cheerful, happy, good with life, that kind of thing. They did, in 2011, this was an open label study, but there were 35 individuals with generalized anxiety disorder that found that holy basil, this is in 2011, friends, that holy basil significantly improved stress and depression scores. All the subjects reported better sleep, reduced forgetfulness, and increased feelings of calm. So they were careful in the study. This is a 2011 one, but they were careful in the study to say it did not, we can't go up straight up against the SSRIs, but the magnitude of symptom improvement was clinically meaningful. So there you go. They also found that it had it was kind of on par with Prozac. So there you go. You can take that, use that for whatever you want. The thing I like about using the herb is with many of these SSRIs or mood supporting medications is that the patient ends up kind of feeling sedated a little bit or emotionally blunted, right? They're just like blah. They don't feel anything. By using the herb, we're going to be able to get that sense of calm. They're going to have an increased, better sense of focus and mood will get lifted. So I think it's a much, much, much better option. And especially in periods of time where we do see mood instability. So we see it in menopause and in perimenopause with chronic stress and fatigue, that kind of thing. So there you go. There's that. Now we're going to super quick talk about female hormones. There was a study on perimenopause and HPA axis, a newer one, but they basically said that, we know estrogen fluctuations make perimenopause just like a roller coaster. Menopause isn't a lot easier, but it's a different kind of roller coaster. We know that with perimenopause, chaste tree is the herb that helps them kind of make that bridge between reproductive years and menopausal years. But what they found was that anything that we can do during perimenopause to support the HPA axis, sorry. I think I've been saying this for years. We've all known this, but anything you can do to support that HPA axis is going to make the menopausal symptoms much, much better. Much, much better. So think like chaste tree, B6 is a good one. Any kind of nervous system support, adaptogen support, ashwagandha. I love using that one pairs well with chaste tree for perimenopausal women. So, they don't really need quote hormone support because they're in that just tumultuous in between time. But using adaptogens, even if you had to use like RoNe&x or full spectrum licorice to help with cortisol, great for them, really great for them. So there you go. There's that one. And then there was another study that was, I don't like part of the study, so I'm going to give you my options here. But it was melatonin, cortisol, and nighttime wakening. Basically, the study said, give someone melatonin before bed and it will reduce their cortisol spikes during the night and improve sleep quality. And it reduced the 2 to 4 a.m. wake ups. Trial was with melatonin. They said, or you could use a calming adaptogen like a reishi mushroom. Okay, but I said, no, I'm not doing melatonin. Melatonin is a hormone. Anytime you give a hormone over time, it will downregulate those receptors. So I said, well, what kind of herbs would we use for sleep? So here's a quick recap. Basically, you want to think about passion flower. If you look at the sleep products that Gaia has, I am 100% a fan. They have sleep formula, they have sleep maintenance, they've got several different sleep formulas, and they don't have all of these herbs that I'm going to give you, but they have a lot of them in them, and I'm getting great results using those with patients. So passion flower is one of them. It improves GABA, so really helps with sleep latency, right? Especially for that sleep onset insomnia. So mind is racing, they can't settle. Passion flower is really good for that, and it's great for kids. Well, California poppy is also a good sleeper, good for light sleepers and people who wake up and are really sensitive to noise or sound at night. It's also good when the limbic system or the emotional system is overactive at night. They're worried about things or that kind of thing. Another one it's good for is pain that causes lack of sleep. Someone who's in pain at night, it can help to calm that pain. Lemon balm is another one that's also good for irritability and mood, digestive upset, but it helps with like tension that's interfering with sleep. So it just quiets the nervous system down. Valerian root, we all know what that is. That's such a great herb for just relaxing the nervous system, reducing muscle tension. Valerian is a strong one. You would use that for someone who has maybe more significant sleep disruption. They just like they're up, they can't fall asleep, and then they stay asleep for 2 hours, and then they're up for 2 hours, and then they sleep for an hour, and then they're up again. Like that's a significant alteration in that sleep cycle. So I don't like to use vervain long term. Valerian. I like to use it intermittently. So use it for a little while and then give a break. And then use it for a little while and give a break. Another one is skull cap. Skull cap's just so good for the nervous system. Post burnout, like overstimulated kind of thing, wired but tired, skull cap. And then holy basil, again, Tulsi, right? We're back with that's just so deeply calming, helps to sedate and calm and improve sleep quality over time. That one might take a little bit more, a little bit longer, but again, it's helping with cortisol spikes. Chamomile, great. I love chamomile for kids. It's good for digestive upset as well. Very safe to use long-term. You can use chamomile tea. You can put the flowers in. The kids like that. Like, it's very calming. It's nice. And then lavender, of course. Lavender's just kind of good as a general calmer downer. Great for kids too, to just put lavender, some kind of like a sachet or cloth, or you can just put some essential oil on and put it in their pillow at night. And that they just breathe that during the night. And it helps with kids that don't sleep well. So you can use that. So, all right, wrapping it up, baby. Let's bring it home. So here's what I would say, like sleep-wise, sleep onset. I love the Gaia product that's called Sleep Formula. And my friend Christine, again, she said, sleep formula is for falling asleep. I went, oh, that's a really good way to remember it. And then the other one is sleep maintenance from Gaia. And I mean, I don't get any kickback from them. I'm just telling you what I love. Sleep maintenance, what is that? Maintaining sleep all night long. And then you can use those, the sleep formula, the sleep maintenance. There's a couple of other ones, but those two are two of my favorites. There's also the Somnimint one, Somnimint Rosmarinic Complex, I think is what it's called. And it just is such a nice relaxer. It makes you not want to get out of bed in the morning because your body is so relaxed. You know how you find those positions at night when you sleep and you just feel like your muscles, your body's kind of, you can't even feel it because it's so relaxed. It's like melted into the bed. That's what Somnimint does. At least that's what it does for me. So when I wake up in the morning, it's not that I'm tired or groggy or I'm fatigued and I don't want to get up. I'm just so comfortable and so relaxed I don't want to get up. So before we wrap it up, I want to tell you too about a new test that Diagnostics has. And they were talking about doing this when I worked there, 15 years ago probably. But now you can order an expanded ASI or adrenal stress test. And basically what that is an extra vial that you can have the patient take at night when they wake up in the night. If they're a waker-upper at night, just have them take that vial at night. And when they collect the saliva at night, it'll tell you if the insomnia is related to cortisol. If the cortisol comes back with that nighttime fifth measurement, they do the 4 measurements, basically the lazy boy chair, right? First thing in the morning when you wake up, right around noon, somewhere mid-afternoon, and then the 4th sample is before bed. And then if they wake up at night, there would be a 5th sample. If it's related to cortisol, you're going to know, and then you'll know how to better manage that. So it just helps to know if a cortisol spike is related to the insomnia. So, I guess to kind of bring it home with the stress part and the adrenal part, I think testing is never a bad idea. Adrenal stress index or whatever lab you use. I just love the ASI from Diagnostics. It's inexpensive. It works. It's got everything you need. But I really like that. So you want to see where they're at. If you've got a stuck patient with adrenals and stress and that kind of thing, and you can't figure it out, it's okay. Just start by ordering a test. Or if you feel confident about what herbs or what supplements you want to use, just start. And if they get better, then great, you're over the target. And if they don't and you get stuck, then you can order a test. But the herbs are always going to work. They're just going to work. So if you need to, some patients need it too. I will say that. I don't always test now because I've just seen so many and I know what works. So now I just do what I know works. And if it doesn't work, then I'll order a test because then I'm stuck. But I don't have to do that very often. But I've just had too much experience. So if you're newer to this, if this feels a little overwhelming for you, start ordering the ASI test from Diagnostics. It's a great little test. I love it. And then start to build the protocol out as much as you can with your particular patient. So you don't want to make it more complicated. I don't want you to feel like, you're struggling to try and put a protocol together. Like the patient comes into you for the first time and they're just a dumpster fire. There's all kinds of things wrong. You can almost guarantee that they're going to need an adaptogen. They're going to need it. I mean, you cannot live in the world today and not have stress. Work stress, life stress, whatever political stress, whatever, is there a war? Is there going to be a war? Is the world going to end? Are we going to be hit with a meteor? What's happening? Like money stress, inflation stress, it's kid stress, all the things. So you can pretty much guarantee that someone's going to need some kind of adaptogenic support. If you're not sure what to do with a patient, just start there. I always say start with digestion first and give them something for stress. And then say, I'll see you back in 2 weeks and we'll talk about the next steps. Perfect. They're happy. I'm happy. They're going to feel better right away. And then it gives me time to deconstruct the dumpster fire and figure out what I'm going to do. Because sometimes I can't figure it out right away. I need a day or two to kind of sleep on it and think about it. And so I'm good with that. I'm like, go, here you go. Adaptogen and upper digestive support. And I'll see you back in 2 weeks. It just gives me time. So think about it like that. Everybody needs an adaptogen, in my opinion. I really think so. And I think if you put everyone on either Ashwagandha or Rhodiola or holy basil, it'd be a home run. It'd be a home run for you, friend. So there you go. That's your adrenal research roundup. I told you I was going to go a little long today, so I'm so sorry. Remember that we don't need to rely 100% on the science because some of what we do is so intuitive. But at the same time, it is nice, even if it's late, that the science comes to the party and shows us, tells us, proves, so to speak, validates is a better word, what we already knew, right? So just, stay open and stay curious. Sometimes things come out in research and I think, I just have to go, who paid for that study? What's happening? Something doesn't feel right here. But I always consider it. I always think, okay, well, maybe everyone has a bias. Maybe my bias is preventing me from seeing something. So if you love these kinds of tips, if you want more clinical insights and wisdom and knowledge about how to put together a protocol or, how to dissect a dumpster fire case, in my example, I would love to have you join me inside Clinical Academy. It is a wealth of information that's designed for clinicians that are in the wellness space, cash-based practices for those of you that are just wanting to sharpen your clinical skills and you don't want to have to go rifling through a seminar binder or looking through, where did I put that note or what is this? What is that? Clinical Academy is where all of it is. It's just there, so easy for you to digest and consume. It's inexpensive. I would love to have you come try it out. If you don't like it, bag out. Love you. Still, we can be friends, right? But you will be amazed. Once people get in, they stay. They just stay and stay and stay because the content is so good. So check it out. Go to rhondanelson.com/clinical academy. I'd love to have you join me. But until next week, take care, my friend, and I'll see you back again on the Clinical Entrepreneur Podcast. Take care.